The tooth crown is the part of the tooth that is visible in the oral cavity. In layman's terms, the artificial covering that is fixed over a damaged tooth is called a dental crown. There's a difference between the functional and aesthetic characteristics of a crown. An artificial crown should always achieve the functional aspects, in effect the right fit against the opposing teeth, as well as in the socket. This is the primary responsibility of the dentist. On the other hand, the aesthetic appearance is the primary responsibility of the dental technician who fabricates the crown. The price of a dental crown has little to do with the materials used, due to the small quantities that are used. With regard to durability and biocompatibility, there are no differences in the materials. All used on humans go through a complicated approval process. The price is directly related to the working time and effort required. This picture illustrates an aesthetically pleasing crown, which is not identifiable unless pointed out. This picture illustrates crowns on the upper teeth, which can be distinguished right away as artificial. Here's the difference between the two. In the first picture, the ceramic has been coated, which means that the patient sat by the dental technician, who laboriously painted onto the ceramic layer after layer until it matched the original teeth. The translucent effect of the tooth can thus be recreated. Not every technician can master this technique. Recreating a beautiful crown is an art. The crowns in the other picture have been made out of a prefabricated shell, and they have been painted according to the color indicated by the dentist. The technician never saw the patient. This is quick and less time-consuming, and so costs less money. Differences between dentists do exist with regard to the fabrication of crowns from the functional point of view. This is why some crowns last for 30 years or more, whereas some last for only a few years. A crucial factor for durability is the manner in which the tooth was ground or cut by the dentist. A quick and easy way is the so-called tangential abrasion. The tooth is simply beveled. The disadvantage of this technique is that the technician has to leave a certain residual thickness of the ceramic while fabricating the crown, otherwise it would break. The result is ugly, overlapping, lumpy edges. In order to hide these, the crown margins are prepared below the gum margin, the gingival margin, because of which a dental probe and/or dental floss can get stuck on the edges of such crowns, as can food particles. These food particles cause inflammation of the gingiva, or gingivitis, with recurrent bleeding. As the years go by, the constant inflammations leads to recession of the gingiva. The edges of the crown therefore get exposed, and the risk of developing root caries is now increased. Another possible technique for crown cutting is the so-called stepped abrasion. This is also a relatively quick process. Unfortunately, the adhesive does not flow very well during cementation, creating a wide joint in the glue. As a result, there is a risk the adhesive, usually cement, can get washed away with time, for example by brushing. This will once again increase the risk of root caries. In the round margin abrasion technique, the advantages of the other techniques are combined and the disadvantages are eliminated. However, this technique is the most complex. The adhesive can flow easily during cementation. This allows for a thin joint. The technician has enough room for the ceramic and the edges are tightly closed, preventing food lodgement. To achieve a round margin, cutting must be performed under magnification. Furthermore, particular criteria must be observed while taking the impression. For example, before the impression is taken, 2 gingival retraction cords should be placed, one of which should be removed just before taking the impression. There are various pastes that can replace the gingival retraction cord, but sometimes these chemicals react with the impression medium and can cause distortion. The result will be an ill-fitting crown. Why are gingival retraction cords necessary? First, because the gingiva must not be cut, and second, because the preparation margin should be placed in the so-called sulcus, in effect below the visible border of the gingiva. The first gingival retraction cord deflects the gingiva to one side in order to avoid injury while cutting. It also ensures that the preparation margins are placed in the sulcus. Fair enough, but why 2 gingival retraction cords? Once the technician pours plaster into the impression, this creates a plaster model of the teeth. Because the margins of the prepared crown must fit tightly along all the edges, these edges should be clearly visible to the technician in the impression. Therefore, the impression material should flow right up to the preparation margins. By laying the second gingival retraction cord, the gums are deflected in the other direction. When the second gingival retraction cord is removed just before the impression is taken, the impression material will clearly record the preparation margins. On the right of this animation, the preparation margin is clearly visible. On the left, the consequences of not using ligatures can be seen. The plaster mold does not correspond to the prepared tooth as the impression material has not recorded the preparation margins. This could be because of the presence of interfering gingiva and/or blood or saliva. The technician will unknowingly prepare an ill-fitting crown. Although many other factors contribute to a good crown, the working methods described here clearly show why the quality and price can vary so much. A good crown does not cause inflammation or recession of the gingiva. It is indistinguishable from the original tooth and lasts for decades. Even if it needs to be replaced, the underlying tooth stump will always be in good shape. There can be certain alternatives to tooth crowns for restoring a damaged tooth. In cases with high aesthetic requirements, veneers and/or bleaching may perhaps be a better alternative to a crown. If tooth alignment is an issue, then braces come into the picture. The particular risks when crowning a tooth are as follows. Death of the nerve or pulp if, for example, the tooth is excessively cut. The consequence is a root canal treatment. Injury to the neighboring teeth, mucosa, floor of the mouth, tongue, or cheeks. Gingival problems or receding gingiva, especially if preparation margins are incorrect or if the gingiva is injured while cutting. Dentists refer to this as injury of the biological areas. And finally, an incorrect bite, painful jaw joint, or headaches if the bite is unintentionally altered by the newly crowned tooth.
Well, with that, we are back, and with this, ladies and gentlemen, we are going to be moving on towards the first topic of discussion, which happens to be fixed prosthodontics, which are also commonly known as crowns. So we are going to be introducing our guest, Dr.Sumoud Al Omar. He is a specialist in dentistry. So, Assalamu alaikum, sir, and thank you very much for joining us.
Thank you for this interview.
It's our pleasure. Now, Dr. Sumoud, if you can please tell our audiences what are prosthodontics, please.
Prosthodontics is that branch of dentistry which takes care of making or offsetting dental or facial or oral structures instead of those which we miss.
And doctor, you know, this is something that definition is many individuals they hear but they don't understand it. But you gave a little more clarification. But many people, they give it the name of calling it crowns.
Yes.
Why is that so? Why do they call it crowns? Just easier way of saying it instead of saying the long words, or just there's a purpose behind it?
Yes, as we see in this case,
Yes.
that crowns or crown, we put them on the tooth or on
So it's like a cover on top of the tooth.
yes, as a cap to protect tooth from the weak situation after RCT treatment. When we make RCT, because of the big cavity caused by bacteria, the tooth will be weak after this treatment, the root canal treatment. It will have a big cavity, so we must cover the tooth with a crown to make it stronger. And also there are other useful uses for crowns to make teeth better in appearance, in shade, in shape, in size. And the most important thing it's to recover back its function for chewing, eating, speaking, etc.
Even
Of
speaking
course.
also.
Yes.
Absolutely. Now, Dr. Sumoud, if you can please ask you to describe just about what are the materials that are actually making up the crowns.
Before nowadays there were metal materials basically, like gold at the beginning and some kinds of metal which were very strong, and the patient can eat very and in good way. But nowadays everything is getting better, so the materials developed to be more aesthetic or cosmetic and at same degree of strength. So nowadays we have zircon in serum and other materials more aesthetic and strong at the same time.
So over time, used to become into more developed, into more efficiency and a better strength. They use from metal to something that the material we're definitely discussing. And what cases need crowns? So can you tell us about the individual? It's like for me, if say I cannot just go to a dentist, say I think I need some crowns, just the idea of it. Yes. What the case or a patient will require crowns?
Okay, there are many cases need crowns. Basically, as we said, when the tooth loses some or much of its structures after RCT treatment, so it will be ready to break. So we make a crown to cover it and to protect it from breaking. Also, some cases, some teeth suffer from pigmentation, as we said, or teeth discoloration. The matter which we cannot solve using bleaching, for example, or scaling and polishing. So we must make a crown to cover it and get a better color or shade or appearance. For example, there are other cases need crowns like the severe crowning of teeth. If patient cannot or doesn't want to put braces, the crown can solve, or the crowns can solve this problem by getting unified, for example, or harmonizing appearance. We put crowns on the teeth and get this harmonized appearance. We can also use crowns as splint. When we have movable teeth because of gum problems, we can put the crowns of them and collect them in one splint, making them stronger. Also, we can use the crown to fill the spaces between the teeth. When we have spaces, the crown fill these spaces between teeth, getting better appearance.
Indeed. And Dr. Sumoud, if we can ask you, what are the different types of the crowns that can be used on patients?
Yes, nowadays there are many types of crown. If we talk about size or shape, there are full crowns or partial crowns. And about the materials, as we said before, there are the metal crowns, and now we have better color, stable with in the oral cavity. Doesn't it change its color or shade, like zircon crowns. These are different cases of crown. My slogan in my work is save your teeth so they serve you. Yes.
That's a good one.
Yes. So if we want our teeth to serve us long time, we must take care about them. This is very important for all patients come to us that they don't know that crowns are very important in dentistry and for their teeth. So if you want to ask me about what advice my patient, okay, the patient must ask the doctor if he need to put the crown or to put filling or anything.
Yes, indeed. And of course, for what is a good appropriate age for crowns to be given? I'm sure for a young age it's something that's very dangerous, it's not recommended, but I'm sure also for senior citizens, because some of them, they have difficulty chewing, or even their teeth is not as strong as individuals in their young age. At what age should the crowns be more appropriate for?
Basically, we plan to put the crown on the teeth which need it if the patient now is 17 for boys and 15 for girls, we can put a crown because we wait for the development of the jaws, the two jaws. So we cannot put the crown before this age. But if the crown is very important to put because the tooth is very weak and we don't want to lose it, we can use some types of crowns like temporary crowns or metal crowns, stainless steel crowns. So we can change them later when the development of the jaws finished.
Right. Now, Dr. Sumoud, we do know that there are many times when the root canal is not done properly and the patient gets an infection in it within the cavity, or the filling was not done properly enough and they get down with an infection.
Yes.
Now, how important do you think is the crown in order to protect the tooth from getting infected, or is it just for a cosmetic purpose?
Yes. After RCT or root canal treatment, which it means that we remove the pulp from the canals and from the pulp chamber in the crown of the tooth, we make final or upper filling, maybe amalgam or composite. Upon the time and in long years after this, maybe there will be some leakage,
Yes,
as
indeed.
we say, bacteria from the from inside the cavity, and maybe it will reach the end of the tooth, which we call it apex, the tooth apex. So if we make a crown and cover the tooth, then we can make a good relationship between the crown and the tooth and the gum, and fill this critical area which can enter the bacteria. So we will have the tooth for a very long time.
Inshallah.
And of course, doctor, you've brought some power slides for us to see.
Yes.
Can you elaborate more about the slides and what do they do? It's like the first one, it's a process of the root canal, which there's an infected tooth, then there's drilling, filling, and crowning. Can you elaborate more?
Is it shown? Yes.
Yes,
Yes.
it's shown.
Yes. Can we make some focus on?
Yes, they will focus. Just go ahead and
Yes, okay.
just start discussing.
Okay. This is what we call root canal treatment, or RCT. We have big caries here, so we drill the tooth and make big access to the pulp canals, okay, and remove the pulp. So after this, the tooth will be weak because of the big cavity and the losing of the pulp, which gives the tooth the strength and the stability. So we crown that. We put a crown on the tooth to make it stronger. Okay.
Okay.
As we see in this
Gross.
slide, this is a very big cavity caused by
So the
bacteria.
tooth has decayed. The
Yes.
tooth is finished.
Yes. So this patient waited long time, and she must
It was a she.
have crowns. Yes, she. She should have crown before this time.
The smoking.
So now the cavity is hollow.
Yes, yes, very big. So she will lose her teeth, and also this tooth here has a very big cavity. So she must cover it by crown to keep it.
And does smoking increase complications like that?
Yes, we must say that we must advise the patient to keep his crowns and his teeth in general. Why? How by cleaning, brushing his teeth, to be good with his teeth as he wants to his teeth to be with him, and use tooth floss between the teeth, okay, and visit the dentist every 6 months to check up and to find any problem maybe
I
having.
don't think those patients came to a dentist for many years.
Yes, yes. As we see here, that this tooth is very weak and cracked before of the RCT treatment and big cavity, and he didn't have crown, so the tooth cracked. And this tooth also will break if we don't cover it with the crown, because
So it's just, that's not a crown, the silver, it looks like steel.
yeah, this is amalgam filling here,
Oh,
very
okay.
big, and this tooth need a crown, or the patient will lose it like this one. Okay, we must know that this muscle, the masseter muscle, is the strongest muscle in our bodies. Yes, here is the strongest muscle.
Oh, the muscle that's responsible for opening the jaw and closing it?
Yes, and chewing. Okay, so if we don't cover our weak teeth, our RCT treated teeth with the crown, it will break. Okay, studies show that most cases of RC treated teeth need crowns. If we don't make crowns for teeth, it will they will break. For example, in this case, we cover this tooth, so we keep it. If we don't it will break.
Doctor, I have a question.
Yes.
What kind of a crown is that? Because it looks just like the natural enamel. That looks
Yes.
very, very natural.
Yes. For example, this tooth is covered by zircon crown. The zircon is the new material and very beautiful, and its structure or appearance is like the animal of the tooth.
Very
You
nice.
see in this case, this is a very big cavity in this teeth because of big caries. Okay, so we put here posts like this metal post, and build up fillings, and we cover the teeth to be like this
Oh,
with
very nice.
zircon. Okay, same in big cavities and big fillings, we must to cover the teeth to not lose them.
And usually when you show this to young kids, for them to be to brush their teeth and floss and avoid any candies and avoid any soda pops. So what's their reaction after this when they see it? Because this is the actual danger that will happen to them, and it does happen to even adults.
Yes, I think after this slides, patient from today will be very careful about these problems. Can we see other slides here?
Yes.
Crowning teeth of big fillings like this.
Oh,
Yes, this is other use for
the
crowns.
cosmetic purpose.
Yes, this patient, for example, has big composite fillings, and this is very, very important. Some patients suffer from changing their composite fillings every, for example, 2 or 3 or 4 years. When we make crowns for teeth which have big fillings like this, composite fillings, we can get rid of this problem and have long-term
And
appearance.
one thing you mentioned is like regular. The next picture was in the preview. Of course, we can see it. Why? Is
Yes.
I think I counted over 8 teeth with
Wow,
big
that is graphic.
Yes.
But one thing is like if individuals come to a dentist regularly, say every 6 months, twice a year, a lot of situations like this can be avoided and the cost will be decreased, of course. Why do people neglect going there? Is it something they say, no, I'm okay, and they neglect? Is that so? What's the most common reason people don't go to dentist?
Yes, the matter I think is related to the pain. When patient has pain, he goes to the dentist. But these visits are very important to prevent big problems later. If patient visits doctor every 6 months, he will save his teeth in good situation, and prevents the small caries to be bigger and to make RCT, and finally maybe he will lose the tooth.
Indeed.
Doctor, what causes teeth to look like that? I mean, naturally, very, very bad oral hygiene, or rather, no brushing, no flossing, no ever buying a mouthwash in your life would lead to that. But what is the cause? Is there like a severe disease, or is it just bad hygiene?
I must say that some hygiene habits here are very bad, like Pepsi Cola or something. Okay,
Soft drink.
especially
Pepsi, they all say
especially.
Pepsi, they all want it.
It damages the teeth, as we say here. In this case, the patient has crowns for his front teeth, as we say here, after treatments of the caries in the front teeth.
The teeth are brown.
Yes,
They're
this
so
is caries.
teeth to be brown.
Yes.
The top picture is completely gone.
Yes, I will show you other cases like this. This is very big caries also in the teeth. So we make a crown to get better appearance. For example, this is disorder, heredity disorder named dentogenesis imperfecta. The teeth, as you see, very bad. So the crowns can solve the problem. Yes, we regain the function of the teeth by putting a crown. So the patient now can chew. Yes, eat. Also, other example, also here, you see, a very beautiful crowns here, like same the shade of the
teeth.
other teeth. You can imagine that this is BFM crowns. BFM means porcelain fused to metal, not zircon. Okay, this is cheaper or less expensive. But if we take care about of preparation, we can get good result. Can
Fantastic.
I? Yes.
Doctor, we are running out of time.
Yes.
Those images were definitely very entertaining, I
call.
would say, because to many of the people at home, you need to be very, very careful. Allah subhanahu wa ta'ala has only blessed you with these teeth. He's not going to replace them with new teeth anymore. So as grown-up adults, please be very careful. Doctor, what is your advice to the people? How often should they brush? How long should they brush? Please, can we emphasize on brushing?
Yes, brushing is the most important thing for people who want to save or keep their teeth in good situation. So we must use tooth brushing twice a day, morning and especially before sleeping. Okay, so we take the toothbrush and use it for 2 minutes. 2 minutes, please, in vertical movements. These movements are the right to keep our teeth in good and healthy situation, and from inside also, and brush our the molars by horizontal movements also.
I see.
Okay.
Indeed. And definitely thank you so much, Doctor, for joining us today, especially I guess Nihad was very traumatized by the picture, but it's a very wake-up call at that, because this is something that individuals, I don't know how they want their teeth to look like that, you know, and they look a lot better with the proper teeth. Being hygienic can do a whole lot of difference and have a better appearance regarding it.
I hope people or our followers not to be afraid of these cases. I hope them from now will take care
Better
more
care
and
with
visit
yes.
Dental clinics.
Indeed, definitely. Thank you so much, Doctor, for joining us today, especially with those amazing slides to really wake up the individuals. Again, thank you so much.
Thank you.
Indeed, and for our dear viewers, Dr.Sumoud Al Omar was a specialist in dentistry, and today's discussion was about crowns and the dangers of not being hygienic and visiting to a dentist regularly. At the moment, dear viewers, take a quick and short break and return right after. Stay tuned.